When we talk about timing of hormone replacement therapy, we're usually talking about it in the sense of heart disease, like heart health and bone health and brain health, but brain health in the sense of cognitive function and reducing your risk of Alzheimer's. But what I want to talk about here is early intervention in your mood. So we know that when you're perimenopausal, you're at a 3 to 4 times increased risk of developing new or worsening depression. Great, another thing to add to the list. But when, as your estrogen goes up and down, it has a great effect on your serotonin pathways, your GABA pathways, and your dopamine pathways that you are feeling. Some people don't feel it, but some people really do. And I talk about this with my patients all the time. Like sometimes it's mostly mood is what we're talking about. And so what they found in studies is adding in an estrogen, usually a transdermal, so through the skin, estradiol does the best, okay, and a micronized progesterone. A synthetic progestin might not be as good. It seems to sometimes blunt the effects. But the important takeaway here is that intervening earlier during perimenopause seems to have a better effect than adding it in later, so during menopause, okay? So being on the lookout for these things can be a helpful, thing to note. And this is not a solo therapy, okay? So we want to make sure that you're doing therapy if that works for you, you're on a medication if you need to be, exercising, sleeping, and I think that it's twofold in that respect. If your estrogen's going all over the place and you're having hot flashes and night sweats, you're not sleeping, which is worsening your mood. So it's a never-ending cycle. But diet, stress management, counseling, all of those things, it's all part of a toolkit that you can use. But I just want everyone to know that estradiol should be considered in that toolkit if you're entering menopause or perimenopause and you're starting to feel like something is off and your mood is worsening, you're having more anxiety. Talk to your doctor, see if you can get your levels checked, or talk to, you don't even need levels. If you're starting to have symptoms of perimenopause, it doesn't, you can start hormone therapy. So I hope this was helpful in understanding that.